Hello, I'm Dr. Bedir Akbar, a general surgeon at Lake Huron Medical Center. Today I want to discuss diverticulitis. Diverticulitis is a very common disease. It is one of the top 10 most routinely diagnosed inpatient gastrointestinal conditions. Diverticulitis is the inflammation of something called a colonic diverticula. It is an extremely painful condition and can take a very long time to resolve. Diverticulosis is when you have these little protrusions or bubbles on the outside of your colon, most commonly occurring on the left side of the colon in America. The two main causes are age-related collagen breakdown, which occurs as you get older, your colon gets weaker, and increased intraluminal pressure from within the colon. Obviously, we can't control our aging, but we can control the intraluminal pressure by controlling our constipation. Making sure we stay regular is the one thing we can do to decrease the chances of worsening our diverticulosis and subsequently decreasing the development of diverticulitis, which can make you very seriously ill and potentially need life-saving surgery. But not all cases are treated the same. This is a spectrum of severity. In general, there are two main types of acute diverticulitis: uncomplicated and complicated. Uncomplicated may simply need oral antibiotics, or you may need to come into the hospital for IV antibiotics, IV fluids, and to make sure we're monitoring you. Complicated patients are typically much sicker. They will need hospitalization, they may even need a drain placed through the skin, or could need emergency surgery. Unfortunately, many patients end up with a temporary colostomy or stool bag in cases of perforated diverticulitis. It is also important to talk to a doctor about having a colonoscopy. Diverticulitis can often mask an underlying cancer. Colonoscopy is performed to rule out any colorectal cancer or pre-malignant adenoma. I'm often asked if eating nuts or seeds will create or worsen diverticulitis. The simple answer is no. You can come and talk to me in person, but the biggest risk factor by far is constipation. Most nuts do have fiber in them, and eating too many of anything, including nuts, can sometimes cause constipation. I recommend at least 8 large glasses of water and at least 30 grams of fiber daily to stay regular. If you don't have a surgeon, I will be more than happy to help. I can be reached at 810-216-1148. Thanks for listening and for living healthy with Lake Huron.